And I had a question for you. You know, I'm going to have the right breast removed because I do carry the gene, the A2 or the BRCA2
Right.
gene. So the suggestion is they remove the other breast as well as the ovaries. Now, I've been told that when they remove the other breast, they may be able to do an implant right away. Have you
So
heard
you're
of?
talking about reconstruction. That's the next thing
Okay.
that I want to talk about. And
Okay.
that's so important for you. It's so important for every woman out there. So I want to take you through a little bit what we do with breast reconstruction. So let's assume this was your mastectomy here. Nowadays, what we do is probably the most straightforward method of breast reconstruction is putting in what we call a tissue expander. You place that below the skin. Over the course of 4 to 6 months, you're overinflating, stretching that skin. You want to overinflate it 40 to 60% more than the actual implant that you want. So how you do that, you inject saline into this through this portal. Over time, you've stretched the skin. You're now ready to put in a definitive breast implant. We place it inside below the muscle, like so. And in your case, Anise, we can reconstruct the side that you've already had your mastectomy and put in a tissue expander. So that gives you a little bit of idea of how that works. The implant is placed below the muscle, and both sides can be done for you at the same time. Now, finally, you know, your nipple areola is being removed also. That's a later stage procedure, but we can put back a nipple areola complex as well.
That's great to hear.
It's good to see you smile.
Yeah.
You see, there is hope.
We talked about, you know, maybe taking your ovaries because of the positive gene.
Yeah, and that's a question I have for you. They said with the gene, it's recommended that they remove the other breast as well as the ovaries. Now, I'm wondering why not just do a full hysterectomy at that point? I mean,
And that's a really good question because you do sometimes leave, because you can also, besides having increased risk of ovarian cancer, you can also have an increased risk of tubal cancers in your tubes as well. And if you only take the ovaries, sometimes there's a little bit of tube left. So if you do the whole thing, you can be, you know, you can totally remove it. This is all about restoring your quality of life. Okay? Yeah, because we want you to have a fantastic long life with your family.
Feel good about yourself.
I want to thank you so much for sharing your story with us. And I just want to give you a quick opportunity. If there's anything you want to say to all the ladies here today and all the ladies watching at home.
I think just, if you feel something, get it checked out. It's not a death sentence. Just because they tell you you have cancer doesn't mean you're going to die. It just means you're going to change the way you live a little bit.
Thank you.
Right.